don't think I've been able to talk about like that birth and what it made me feel like because I just haven't been able to talk to anyone about just that. It was very, very different for me. But
It sounded so, so intense. I mean,
it was just, a different introduction to parenthood. But when people talk about being traumatized at a hospital and they say, oh, it's because they had a C-section or whatever, you can be traumatized no matter how you give birth in a hospital because it's scary. Giving birth, no matter how you do it, it can be very traumatic and just, because you're not in control. And the providers can only help you along so much. And it's just, oh, it's so much. So even now, because I take my child to a doctor who's at the same hospital, because our doctors are at that hospital. It's attached to where the offices are. Oh my God. My kid wanted to see where they were born. So I took them to like the area, and it's a waiting area, and there's like the fish tanks that you look at while you wait. And I started getting really panicky. And I was anxious and I wanted to get out of there. I couldn't handle that feeling of being back in that place again because it was a lot. So I do think if you're feeling that way, and especially if you don't have an option of giving birth somewhere else, or if it's a place you have to visit a lot, do seek out some help. Talk about what you went through. Ask your provider to help you with some coping mechanisms, some calming techniques, just anything to get you through it. Because if you're there a lot, you're going to have to think of ways to deal with that. Don't avoid a hospital or seeing a doctor because it's in that same place, because you might have to go back. And so you want a good toolbox of things to help you get through that experience if you need to go back for any reason, and not to avoid a hospital or a doctor because you've been very frightened and traumatized there.
yeah, I mean, I worked in a pediatric hospital, and pediatric hospitals, yeah, there are children there who are patients, who are what I call the frequent flyers. They have to come back and for their care frequently, more frequently than anyone would want to. And pediatric hospitals they have child life, which is a multifaceted department which handles everything from entertainment, recreation, dealing with their therapies. They'll come in and they'll help prep the kids for their what am I thinking about? Their whatever their care is, their protocols, and they have all of this stuff. It is a known thing. They know how to do it in children's hospitals. They don't do it in adult hospitals, which is honestly a shame, because the kids are even more vulnerable than adults. And if we have a way to protect and facilitate their care and their well-being, you can do it with adults too. I mean, maybe hospitals have it and you have to ask for it. I don't know.
But it should
Maybe
be part of the plan of care.
it should be part of the plan of care. I mean, they deal with patients who are high needs for whatever reasons, behavioral health issues. I'm sure they have ways of doing it. But I mean, I hear people who say, I've had, the person who asked, they had 3 C-sections. They were like, I want to do a home birth. And we were like, oh my gosh, no, this is not a good plan. You may want to do this. I mean, it probably sounds like a great idea. I've had 3 C-sections. They all sucked. I don't want to do this again. I'm pregnant. Maybe I'll just have a home birth. That sounds logical until you realize that the risks you're running are pretty grave, and that what you really need to do is you really need to say, how can I make this birth not suck like the others? How can I have a better experience, even if it's not a great experience, still something that you can deal with in some way. It's I don't blame people for wanting an out, but it's not worth the risks you run to take it.
When people are having to advocate for themselves and they're already very vulnerable, they're having to see a lot of doctors or for whatever reason, sometimes, especially, okay, so for me, culturally, I've always taught to be very polite. You have to be very kind the way you say things. You have to be very careful not to upset people the way you talk. And maybe you have to be okay upsetting people and saying it just how it is and not worry about if you're wording it kindly enough. If I would have told my provider, look, you suck at this. I'm trying to tell you that I don't feel good and you don't seem to care, I probably could have gotten better care. I probably would have had what was going on with my emotions taken seriously if I could have stepped out of that. But culturally, I could never do that. I can't talk to people like that. It's very hard for me to do anything where I'd be perceived as being really impolite. So that's something to think about too, that if it's your culture or if you're afraid. I didn't have any providers that were anything but white, and my partner's white, but I don't identify as that, and it's not how I was raised. I wasn't raised in that, around people like that. So I'm really, I think in my care, afraid of talking a certain way because I don't want to be labeled as hysterical. I don't want to just be an angry person. I want to be able to talk and be taken seriously, and that's part of it for me. There's just a whole other aspect when you have providers who are a different race than you too. So that's a concern. We know that there are people who really are suffering because of systemic racism. I didn't have the same problems. I was able to get care, and I was able to have providers listen to me in other ways. So that was not an issue for me, but I wonder sometimes if part of the reason my mental health wasn't taken seriously was a barrier like that. And it's so much worse for other people. And that's why we see the outcomes that we do. We don't have providers who understand that cultural aspect.
You know what, though? I think you hit something really, right now, you just hit something that actually connects with me, because I was undiagnosed for years after losing my son. Nobody found depression, nobody found anxiety, nobody found PTSD, nobody. I've been going to OBs every year. I've been seeing a primary care doctor every year. I've changed doctors. No one has seen anything. I do the little test things. I tell them I don't sleep worth a shit. I tell them I'm not eating. No one was paying attention to me at all, because they were like, it's moderate, it's expected, you lost your kid. That's literally what I have been told almost by every doctor since my kid died, is it's expected, you lost your kid. Nobody's offered me therapy. Nobody's offered me anything. I think I was offered meds at the hospital when we lost our kid, and never again. Nobody ever offered me anything. So I go into an appointment just like you. I'm nice. I'm happy to be there. I'm excited to take care of my health, take care of my well-being. So of course I want to hear everything that they have to say. Of course I have questions, whatever, do whatever testing you need to do. I'm very open to it, but I'm also the very nice, calm, level-headed, listening to what my provider is going to say. Now, if I start outbursting, or if I start freaking out, or if I'm sure somebody would have actually noticed, but every appointment is just like I'm talking to you guys. I'm laughing, I'm hanging out. Sometimes I'm telling jokes. Like, that's part of my personality. But the reality is, what I've learned now that I'm in therapy is I have detachment issues. So I can detach from the situation, detach from my own feelings that I carry around with me. And so when you ask me questions, I'm like, I'm not depressed. When I had the doctor finally tell me you're depressed and you need meds, I was like, no, I don't. At this point, it's been years. I was like, I'm fine. I've worked through that. I don't cry. And then there was another thing. there's the people that cry all the time, and then there's the people that don't cry at all. So we're having there, it's hard to diagnose something when there's so many of us and there's so many different things to diagnose, and how can you separate us and how can you figure us out? Because some of us don't know that we have a problem. Some of us go in and say, maybe I have a problem, maybe something's going on because I feel different, but are you crying? Are you suicidal? Are you? No, I don't have any of that. So I slid under the radar all these years because I'm nice. I'm too nice. I'm too happy when I go into my appointments. I laugh, I talk, I hang out. I'm, whatever. But the reality is when I'm going home, what's going on in my everyday life? And I wouldn't say I had been dismissed all these years by all the providers that I've seen. I think they were all generally doing their jobs. All the testing is always pretty much the same. Some of them was like 0 to 5, or, a very this way or very that way. I mean, this stuff is kind of whatever. I just took a test a couple weeks ago. I had to take a little test thing. And when you fill it out with your numbers and you get to the end, it was like, you are moderately depressed. And I was like, yeah, I'm moderately depressed.
Got an answer.
Like, you know what I mean? Like, from just doing the little test myself, I handed it in. Nobody said anything to me. Nobody looked at my paperwork. Nobody looked at whatever. But it's like, it's kind of like that. Nobody's saying anything to me. But when I went to my next appointment, that I was like, oh, I got to bring my paper. And I'm like, somebody's going to notice. It says in there, I'm moderately depressed. I'm not extreme and I'm not like normal, but I'm moderately depressed, right? Nobody has said anything until right when I was about to leave. A nurse actually said to me, she actually turned and said, so I heard you lost a baby. But nobody, it's almost like people tiptoe around me. And that is something that I had noticed, is that doctors sometimes are more, OBs, primary, they seem to be more direct. But when I see a nurse practitioner, normally they tend to just kind of try to get me out of the room with them. Like, they don't want to deal with me. They don't want to go over things. If I start saying I'm feeling weird or something's off, it like freaks them out. I've actually had a couple where I can tell they freak out when they look at my stuff and they actually are looking into my history. I can tell they don't want to have the conversation with me. Not saying that's for everybody, but it's my experience of what I've had.
Question.
Yeah.
If on your history you didn't have a loss, you hadn't lost a baby, do you think they'd have a completely different reaction to you? Do you think they'd treat you differently?
I think some of them would. Yeah. I know that sounds weird, but I've noticed doctors are more of, if they see it, they might ask me why. They're like, if you don't mind, can I ask what happened? Da 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 da. And they want to know, and they kind of tend to chart it out a little bit more and put it in the notes. But I've noticed nurses want nothing to do with it. It's for some reason, because I've gone in, I had to go in and I couldn't get into with the doctor, had to go see the nurse. And when she basically ignored everything that was right there written by my doctor of me, like what was going on, why I was there. I won't explain why I was there, but she ignored everything that was there and was like, nope, we're going to do this. We're going to do this. And I was like, but that is completely opposite of what my doctor is telling me. And I just see my doctor, and I'm only in here like, maybe I should see my doctor because you're not listening to me. And it was just like, for whatever reason, what I got from her was, it was like when she came in, she was fine. But when she opened my chart and actually started looking at stuff, I freaked her right out. And it wasn't like my health stuff is really that complicated. I don't really have anything. I'm actually pretty normal, other than I've had a lot of surgeries. Obviously, I've had babies. I've had, other than that, there's really nothing in there, because basically in my life, I haven't had anything. In my 20s, I barely ever went to the doctor at all. So who knows what my background was? Like, there's nothing to chart, So when you looked at my stuff, it was like, there's really nothing. But it was like, as soon as they go back far enough where they see that happened, I get a lot of like, oh. And like I said, some people are really, they want to know and they chart it out. And some people like the one lady almost threw her pad at me and ran out the room. Like, she literally was like, it like freaked her out. And so I notice people treat me a little bit different. Now, not saying that's for everybody because I do get pretty good care. I'm not gonna lie, I do get really decent care of places, and they don't know anything about me. They're just the vital lady, or you know what I mean? They're really just nice people, and I'm like, they're perfectly in their position. But I can tell when people look at my chart, because it just happened, of a lady that didn't know anything. She's just doing her thing of the generic, this is what you got to do, go in here, pee in a cup, blah, 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 all this stuff. And then as soon as she sat down to open my chart, she only knew my name and my birthday because it's on my wrist and you know what else. As soon as she opened my chart and we were chatting and laughing and have a good time. As soon as she opened, she got really quiet. And then I was talking, and then I just noticed she was kind of just doing this. Like you know what I mean? Like she didn't know what to say to me. So she just kept getting closer and like staring at me. And that was the moment where I was like, she went in my chart and seen that I've lost a kid and she doesn't know what to say. She doesn't know if she should bring it up. And she's like, okay, I think we got all your history here. And that's what I've noticed. So I can't imagine somebody that doesn't have a loss that's an obvious trauma. Now, you've had trauma, whether it's a vaginal birth, whether it's a C-section, whether it's an emergency, whether it would things just happened, you teared, like stuff happens. I can't imagine if somebody's not seeing this as a trauma because it's like, oh, it's normal for you to have birth trauma, that of course nobody's going to get diagnosed for any issues. You know what I mean? They're going to totally get kind of dismissed because, oh, that's normal. You just gave birth. That's all it is. You gave birth, whether you went in for emergency, whether baby just came out and it was scary. Like there's so many different things. I can't imagine in that way. And I hate to say it, I think I've noticed a lot more online that are saying they're just not getting that mental, emotional support and help. And I don't think anyone's doing it on purpose. I really think it is something of, I don't know, maybe we need a better system. Like maybe we need to update a little bit more where it's like, you know, more than just the boxes. Maybe we need to have somebody that's, I don't know, a social worker or something, somebody that actually deals with this a little bit more, that sits down with us, because pregnancy just changes everything. And then have a baby changes everything. You know, I just think that there's a lot more people walking around with trauma that they're carrying than we think. Yeah, exactly. And it's my experience with loss. I have a lot more people sharing their trauma because it's like, I'm so open about it and I'm so open about people getting help. So I feel like we really are missing the mark for so many.
I find a pretty simple answer. It's funny. I twisted my ankle some years ago, and I went into the ortho clinic and they did an imaging on my ankle and they're like, yeah, okay, looks like you just had a bad sprain. And then they asked me a question which just completely floored me, and they're like, are you interested in physical therapy? And I was like, yes. My ankle hurts. I screwed it up doing nothing more than trotting down the sidewalk to get my son his lunch because he was waiting at the bus stop for it. I would like physical therapy to help fix my obviously weak ankle. And I was like, you asked me if I need physical. And I think maybe if providers just did the simple question, are you interested in seeing a behavioral health specialist, counseling, whatever, just ask it. Just ask them straight up. Don't even ask, don't even make them justify why are you interested in this service, and see what they say, because some people would probably say yes.
Well, right. You have to ask the question to get the answer. I totally, I feel where I am, we have a lot of providers who are able to treat people with the same things that I had. So we have a whole center devoted to it in the hospital system that I visit. So why is there this gap in treating people who are experiencing these same things? It should be a given. You're right. It should be like, hey, besides the fact that your body and your whole chemical system is being redone by this thing that you're growing in you. Maybe you want to see someone who's experienced in treating this to be screened, and that's who should screen you. Maybe it should just be a matter of course that we're seeing someone and assuming that everyone will have different symptoms, but there's a lot more people who need treatment, and maybe that is a thing too. I love what you're saying. I love that. Just ask.
And maybe we need to make it more normal.
Yeah.
Because I know that sounds weird, but I think people don't think it's normal. Like, I feel like I constantly am telling people online, it's okay for you to ask for help. And that just hurts me because I think, how many of us know that we're struggling and we're not getting help? We're not asking for help. We're not looking for help. We're not anything. We're just thinking like, oh, this is normal. I have to just deal with it. Yeah, exactly. I have to just deal with it.
We're only treating the most severe forms of anything. Like,
are you suicidal? No, I'm not suicidal.
No, like it just took me 20 minutes to figure out how to put my socks on, or like that, because that's part of it too. Just brain fog can be a thing. Like,
there's so much.
It shouldn't be the worst manifestation of symptoms for someone to get help.
Or why wait until you are suicidal? I mean, most people don't wake up in the morning and go, gee, life sucks. There's no point in me living. How about I just, let's start thinking of ways to end it all. No, that's not how it happens. You don't wake up one morning and it happens. It's just a process where you're sitting here going, I hurt, I'm suffering, I can't get what I want out of life. I'm not sure why I'm still alive. It's you don't just wake up at the bottom of the pit. You walk through a really dark tunnel before you're to the point where you're just ready to give it all up because it's not worth it anymore. It's just not how it happens. I mean, sometimes it does happen that fast.
Yeah, you're worn down. Well,
Normally
it's because you're so worn down.